The views expressed in the following program do not necessarily reflect the views of this television station. Please enjoy.
Welcome everybody to the Impact and Influence Show. I'm your host, Rob Harter. This show is all about featuring individuals and organizations that are really making a difference in our world. Now here we are, we're on the road again. I love taking you on the road and inviting you to visit places maybe you've never been to before. And here we are at the People's Health Clinic. Now this is one of those organizations here in Park City in Summit County that really are making a difference in our world. Now I know healthcare is a hot topic and we wonder a lot as a nation, why healthcare costs seem to rise and continue to go up, and what about the uninsured, and what about people that can't afford healthcare? All those questions. Well, what we're going to do is focus in on what the People's Health Clinic is doing. They've been around for 19 years, and they provide healthcare for those who can't afford it typically, and specifically those who have no insurance. So you're going to get to meet the executive director, Beth Armstrong, hear from Dr. Hanrahan, who was one of the founding members of the organization 19 years ago. He's actually the medical director, so he's still serving and working here. But before we do that, and before we give you a tour of this wonderful facility, we have a very unique and special guest. His name is Chris Waddell. He's a Paralympian skier. He's also a wheelchair track athlete. In fact, in just a minute, I'll list all the different awards that he's made up, or he's actually won. Now, here's what's interesting. As he grew up, he became a very good skier. And when he was at Middlebury College, he had this tragic accident that caused him to be paralyzed from the waist down. But that didn't slow down Chris. I mean, this guy has racked up more awards than I've ever seen. And you're gonna really enjoy his story. He's very inspirational. He travels all over the world, literally, to tell his story and talk about all that he has done. And he's also started a nonprofit called One Revolution. I really look forward to introducing you to Chris Waddell. We're gonna take a quick break, and when we come back, Chris Waddell. Rob Harter here, and I want to talk about the third annual Latino Arts Festival. We started it 3 years ago because we wanted to create an event that was really special, that celebrated the Latino culture and brought the entire community together.
Artwork is part of our human soul. We need to celebrate that. We want to invite all people who make up our community to come and enjoy the beauty and colors of the Latin American culture.
Well, it's June 16th and 17th, Saturday and Sunday. It's going to be right outside the Park City Library, which is a perfect spot because it's right in the heart of Park City. Lots of parking, public transportation is available, and all the amenities that you need. Particularly if you bring your family, the kids can run around outside because most of this event is going to be outside on the green, outside of the Park City Library.
This event is really a spotlight on the creative talent of our local Latino community. We're going to see the creative expression, the food, the sounds, the music, the dancing, the colors that really make our mountain community have texture and dimension and personality.
We couldn't really pull this off without community partners. For example, the Park City Summit County Arts Council. They've been a great collaborator in really helping us think through this event and do this in a way that really celebrates the cultural aspects of both the Latino culture and all the artists that'll come.
The mission of the Arts Council is to promote, support, and strengthen arts and culture community-wide. The Latino Arts Festival is a perfect example of how we're using arts and culture to bring our community together. It's going to be a fantastic couple of days, and I really look forward to seeing you there.
It's going to be a beautiful, wonderful experience.
For more information, go to our website, ccofpc.org. We look forward to see you there. Para más información, vayan a nuestra página web, ccof.org. ¡Te esperamos!
Well, welcome back to the show. We've got a very special guest, as I mentioned, Chris Waddell. He lives right here in Park City. Now, many of you probably already know who he is. Now, some of you may not, though. And so I would love to have him tell his story to all of you today. And I had to keep these notes, Chris, because your list of awards, it truly is amazing. It's inspiring. So as I said earlier—
I write all that stuff myself.
I wonder about that. Well, welcome back to the show. We've got a very special guest, as I mentioned, Chris Waddell. He lives right here in Park City. Now, many of you probably already know who he is. Now, some of you may not, though. And so I would love to have him tell his story to all of you today. And I had to keep these notes, Chris, because your list of awards, it truly is amazing. It's inspiring. So as I said earlier—
I write all that stuff myself.
I wonder about that. That was really impressive. Right from Wikipedia, it's very impressive. But okay, just get this. So Chris Waddell, as I mentioned on the beginning of the show, an American Paralympian skier, but also a wheelchair track athlete, a great skier. And then when he was at Middlebury College, he had a tragic accident that made him paralyzed from the waist down. But that didn't slow down Chris. I mean, this guy just continues to rack up the awards. So let me list them for you. 4-time Paralympian, 12 Paralympic medals, 5 gold, 5 silver, 2 bronze, 6 World Championship medals, 5 World Cup wins, and 32 national titles skier of the year. I mean, that is truly amazing. So tell us now, those who maybe don't know your story too much, talk a little bit about what would you want people to know about you today?
You know, I mean, it's funny because the Paralympic part was a huge part of my life, obviously, and I had my accident when I was in college. So coming back to skiing in a lot of ways was my greatest teacher. You know, it's where, one, you're hoping to realize your potential. Unrealized potential can be really frustrating. Wanted to realize my potential, but at the same time, it's where I had my highest highs and my lowest lows. And I wanted to find a way to really learn about myself. So the Paralympic experience was exactly that. So I did actually 4 winter games and 3 summer games. So 7 games total. Incredible. One medal in the summer. But
do you ever rest? That's what do you ever rest at all?
You know, I think so. I think I really look forward. I have a sprinter's mentality, like go really hard and then stop.
And then just crash.
Yeah, exactly. So yeah, because I was really a sprinter. I ski raced and did 100, 200, 400, and 800 meters on the track. So it was really more of a sprint. Wow. The hardest thing that I ever did actually was retire. So I was in the hospital for 2 months, went back to school, and then went straight into skiing. I mean, 362 days after the accident, I started to ski in a mono ski. But so it was kind of this building all the way until the end. The games here in Salt Lake in 2002 were really a huge pinnacle for me. I stayed on for 1 more games. I competed in Athens in 2004. But in a lot of ways, 2002 was the end of it, and it was that was the hardest thing because identity, these kinds of things were a real challenge because I was an athlete, and being an athlete made me different. Right. And then I was like, well, what am I going to do with the rest of my life, and how am I going to be successful? In some ways, you think, oh, was I at my very best at 25 years old?
Peaked out?
Yeah, exactly. And is it all downhill from there? You go, well, that doesn't seem so good. So, yeah.
Right. Well, I know you've not stopped though, even though you're maybe officially retired from, being in the Olympics or whatever. But so talk about that. So one of the things that's really incredible about Chris, one of his feats was that he is the only paraplegic that actually climbed Mount Kilimanjaro, as I understand it.
The first, nearly unassisted. So the intention was to be unassisted.
Talk about this experience.
Because there have been some other people who've gone to the top, and there have been things where, I was intending to do it all under my own power. Yeah. And in some ways, it'd be like breaking a record if I was able to do that. Okay. And part of it, when I was skiing, going 70 miles an hour on one ski, that forced people to look at me differently. And in some ways, to see beyond the wheelchair and to see a lot of the people who, in our world, are invisible. Yeah. From the time we're little, we're taught not to stare at somebody who looks different. Right. And in a lot of ways, as a result, people with disabilities become invisible. So I wanted to find a way to really, to really hopefully get the world to be able to see them and change the narrative from, oh, well, that's too bad, to what do you do? Right. Because we're all doing something, right? And if we're passionate about something, that's incredibly inspirational, and we can all learn from each other as long as we have our eyes open.
Yeah, that's wonderful. And I know you speak all over the country, all over the world, in fact. Is there a person that maybe has been truly inspired by your story? And I'm sure there's a lot, but there's a woman who really stands out among the crowd that really heard you speak and has made a difference now in their life because of your story.
That's an interesting question because it's much easier for us to know who inspires us, but not necessarily who we inspire. I get it with some of the kids, and it's been amazing. With my foundation, we do a program called Name Tags. Okay. So with One Revolution Foundation, we do a program called Name Tags, which is about the labels that we put on ourselves and others, which are often our limitations. And it's about getting beyond those limitations. It's one part resilience, where our motto is, it's not what happens to you, it's what you do with what happens to you. But it's also about finding your unique voice. It's really easy for all of us to kind of follow the crowd and at some point go, well, this isn't super fulfilling for me. This isn't what I want to do. This isn't my passion. And in some ways, I don't know exactly what my passion is, so I have to kind of figure out what my passion is. So trying to help kids to be able to do that, because school in some ways isn't always preparing us for what we're going to do next. Sure. So I get it occasionally with some kids, and it kind of blows me away. I was at a school last week. I was back on the East Coast last week, and it's springtime there. So sometimes it's raining. Sometimes it's snowing, sometimes it's freezing rain.
Make up its mind.
Yeah, exactly. Sometimes it's sunny. And you think, oh, this is great, it's springtime. And you're like, oh, but now it's snowing again. And I was going into this one nighttime event, and this girl came over, younger girl, 14, 15 years old, still had braces on, these kinds of things. And she said, that was really great. And it was really important for me to hear. And you just saw sort of the depth of impact on her and sort of that vulnerability as well, where she said, I really needed to hear this. And so I see that a fair amount, but I haven't always had contact with people, and so I don't necessarily have that one person. I say, oh well, this person, I inspired this person, and then they went on to do that, and you don't really know. I mean, there was one guy who I went to a school. This is back in 2009. It was actually before we did the climb. Okay. And I went to a school, and this kid was a freshman at this school back east. It was Horace Greeley back in New York, and so he called me 3 years later and he said, I've thought about your presentation every day for the last 3 years.
Wow, 3 years.
3 years.
That's an impact.
It really was, and he said, I want you to come back. I want to help organize you coming back to the school, but I also want to climb the mountain and raise $1 a foot for every foot on the 19,340 foot mountain, which I thought sounded like a great idea.
Absolutely.
So he, his father, and his sister all climbed the mountain, and they raised more than $19,000, which was awesome for us, but just awesome to see where it had an impact on him, but then at the same time that he went and did something more with it, and so running with it.
That's fantastic, and I knew we had him here at Park City a couple of years ago, and I know just from that experience, and the way you speak, the vulnerability you share, and the story you share is so powerful. I know you impacted the crowd that was there, and we talked about it for quite a bit afterwards. Now, you started a nonprofit called One Revolution. Right. So talk about the mission of that, and what are you seeking to do through your nonprofit?
The mission, I think, so there are a variety of different things. So I, as a Paralympic athlete, in a lot of ways, we competed, we were an example of what was possible out there, which I think is really helpful, and in some ways more accessible on the Paralympic side than it is possibly on the Olympic side, just because no matter who we are, things are going to happen to us, and how we find a way to be successful within those parameters is something that's great. Obviously, a program like the National Ability Center here opens people's eyes. Yeah. You come in and you think, well, I can't do this, I can't do that. Why would I ever want to go to winter? And then you go skiing and you go, oh, well, this is really cool. And they change people's worlds that way. For us, I think our role is to prepare society for those people who have new potential in their lives, who are seeing the potential, so that society sees that potential and doesn't see the limitations that they assume. And so that's where we fit. And so a lot of what we're doing is why we're going and talking to kids, because kids' minds are open. Kids will ask questions. They aren't bound by political correctness. The other part of it is we can reach a fairly decent market in a short period of time. So average 350 kids, but they're all parts of families, they all have friends. I've had so many parents come up to me and say, my kid came home from school and made me get on your website.
Oh, wow, that's impressive.
It really is.
Impressive. Because telling the parents what to do in a sense, right? Hey, I'm impacted and I'm inspired.
I'm inspired, but so much of it. Kids come home from school oftentimes. How was your day? It was good.
They don't talk at all.
What did you do? Nothing.
Exactly.
So the kids are coming home and they're taking the initiative, and that to me is one of the most flattering things that we can do. But it also, so we've created like ambassadors each time we're going to a school and continuing to get that message out, and hopefully it can create that fundamental shift, because sometimes we as adults are a little bit more difficult to shift. We become a little bit more jaded with it's that whole, the definition of an expert is somebody who knows more and more about less and less. And in a lot of ways, that's what we get to be as adults, right? Like, I know what that is. I've made my decision already. And it's like, kids' minds are open. And that's the really cool part.
Love it, love it. Okay, so if people are watching, they want to find out a little bit more about your show, and about your organization. Right. Where would you send them? Like, how do they find out? There's a website, I'm assuming?
Sure.
There's a Facebook page?
Sure. One Revolution, so one-revolution.org is our website. One Revolution is our Facebook page as well. Okay. A lot of stuff. Pictures from, I think I just finished 13 or 14 school presentations on the East Coast in the last 10 days or something. Wow. I put a lot of miles on the rental car as well, back and forth. Yeah, exactly. Here you go. It's still warm. And but yeah, so checking out some of that stuff. It's not just me. We have a variety of different other Paralympic athletes that we're working with, and we're trying to build out that program right now to get more athletes, more voices out there, but also be able to reach more students, because
People's Health Clinic is a nonprofit in Park City, Utah. We provide quality health care for the uninsured of Summit and Wasatch County. We benefit the community by providing health care for our most at-risk population. We keep people whenever they're most vulnerable. We provide them health care so that before they get so sick that they have to seek out emergency care. So we keep people out of emergency rooms, and we keep them healthier so that they can be more productive in the workplace. It's important for our community to remain healthy so that they can be productive, so that they can show up for work, so that they can take care of their families, so that they can be a vibrant part of the Park City community, so that they can be available for their families and for their community. We here at the clinic believe that every individual deserves a health home and the ability to maintain good health. If for some reason they become unhealthy or fall ill or have any sort of illness, we believe that it affects them personally. First of all, they don't feel well, especially in the case of a diabetic patient or a pre-diabetic patient. Without the care that we provide them, they will continue to become sicker. It's statistically, today in the United States, 1/2 of all adult members of our country have diabetes or pre-diabetes, either diagnosed or undiagnosed. Providing them with the health care that they need and the education that they need, even including just diagnosis, because you can walk around pre-diabetic and even diabetic and not realizing that you have the disease.
Welcome back to the show. So here we are inside the People's Health Clinic. We're here with Beth Armstrong, the executive director, and this is a fabulous nonprofit. And what I thought I wanted to do was just give you an insider's view of this wonderful nonprofit. So Beth, so good to have you on the
Great
show.
to have you. Thank you
Thanks
for
for having
coming.
us bring the show to you.
Perfect.
So
Come on.
kind of walk us through a little bit. People's Health Clinic, been around for 19 years. Tell us about some of the people that you serve. Like, how does this work?
So we provide health care for the uninsured of Summit and Wasatch County. So anyone who is not covered by any form of insurance.
Okay.
And we believe here at the clinic that if you can have insurance, you should. So we actually have someone here at the clinic that is available to assist you in getting on insurance if you are eligible. However, if you're not, then you come back and you see us and you visit one of our fine doctors and we take care of you.
Fantastic. Now, how many people you serve in a year, would you say?
We are, this year, it looks like we're going to serve over 8,500 patients in a year's time. So some of those are the same people coming back due to chronic illness. So we see them every 3 months. That would be people with hypertension, high blood pressure, diabetes, pre-diabetes, and obviously our prenatal patients come monthly.
Okay, got it. So you're going to take us into one of the exam rooms.
Sure.
So if you were to come and you had no insurance, you needed some health care, you just have them come in here and set up an appointment. How does that
We
work?
would actually prefer if you call first, 435-333-1850, make an appointment, and then when you come in, you just walk up, you'll come in and visit, you'll come to our front desk, and you'll sign in. We'll have all the paperwork ready for you. You hand it back, and then we take you back to our vitals area, which is always manned by our volunteers.
Nice.
So here at the clinic, we have over 140 volunteers.
Wow.
You don't have to have
Fantastic.
medical expertise. We'll
Okay.
teach you how to do vitals. So come
Nice.
on back.
You don't have any experience necessary.
No,
just
we'll
come, you have
train
a
you.
willing heart. All right, so 140 volunteers. That's fantastic.
It is. It's wonderful. 40 of those approximately are medical providers. So anything from chiropractic to orthopedic surgeons and neurologists and gastroenterologists. So we have specialists that are here. So if
So they volunteer their time again.
They
so
do.
You only have one physician that's actually paid, or do
we
you
have
a few?
a medical director, Dr.
Okay.
John Hanrahan, who
Right.
actually was one of the initial creators,
Founders, wasn't
yes,
it? Yeah,
of the
I thought so.
clinic.
Okay.
And so he is still with us. He's our
Okay.
medical director. And then we also have a physician assistant, Rochelle, who I hope we'll see later. And she, not only does she provide care for patients, but she also is our clinic coordinator.
Excellent. But besides that, all the other people are volunteering their time.
Yes, well, we have paid staff who
Paid
are
staff,
friendly.
Of course, administrative staff,
Yes,
yeah,
administrative
which is wonderful.
staff.
Okay, so take us in. This is
So
really
this
a
is our
great
intake
facility.
room. So whenever
Okay.
a patient would
Yeah, they just
show up,
come right in here?
you would come in, you would have
Yeah.
a seat.
Perfect,
We would
okay.
do your blood pressure.
Just like any other clinic,
Just
yeah?
like any other physician's clinic, we'll weigh you
Fabulous.
and put everything. We use an online electronic health record.
Got it.
So
Okay.
it's not we're paperless now, so that's fabulous.
That's so nice. That's great.
And
okay,
then
you come
as,
down here.
yep.
Nice artwork on the walls. Love it. Very
Oh, there's a
inspiring.
volunteer right there.
All right, thank you for volunteering. Love it. This is great. Nonprofits cannot function without volunteers, so it's so great you've done a good job recruiting them.
Yeah, we always can use more.
I'm
So we have our clinic or area here, and we have a lab.
Okay.
So we actually draw blood here, and you can
Okay, right on
more
site.
volunteers.
Look at these wonderful volunteers. Fantastic. Thank you for what you do. Appreciate it.
Yes, we appreciate. So we
So you can take actually blood work here.
We draw blood here.
Nice.
We'll do a few tests. We'll actually run here, and the rest we send off.
So here we are in an exam room with Rachel. Tell us a little bit about what the process is once someone gets to this room.
Yeah, welcome. So the first thing is we encourage you to have a seat and be comfortable. The next step in the process is for you to have a conversation with the provider that you're seeing today.
Okay.
We talk about your medical history, your risk factors for current diseases, what kind of screening recommendations we recommend for you today. Then we conduct a physical exam, make sure your heart is healthy, make sure your lungs are healthy, and we listen and evaluate any other body parts you're concerned about. And
Excellent.
after that, we create an assessment and plan for your medical care here. That could include follow-up visits, that could include prescriptions to local pharmacies, that could include a blood draw, which we can show you next, if you're interested in
We
how
may
they
not do
draw
that.
lab.
We're gonna it's a little squeamish for people on TV.
And it can also consist of imaging that needs to be done. We have a relationship with the Park City Medical Center, so if you need an x-ray or a CT scan or an MRI,
Do all that here.
well, we can begin the process
Okay,
for
there
having
you
all
go.
of that done
Perfect,
here. Yeah.
okay.
And then most often we say, it was so nice to meet you. Thank you for coming in
Okay,
today. We will
yes.
see you again soon.
Okay, all right. So you have a lot of repeat customers, so to speak.
We do. We encourage
Yep.
follow-up because it's
Great.
really important to have continuous medical care at any age in your life.
Okay.
And it's easier for both patients and providers when you have a strong and historical relationship.
Yeah.
When we get to know each other, it's so much easier for you to trust me and for me to provide you appropriate care.
So here we are again with Dr. Hanrahan, one of the founders with a group of people that started this about 19 years ago now, almost 20.
Right.
So as you've done this for year after year after year, what has been the most rewarding part of what you do?
Well, there are a couple of things, I think. One is that over that period of time, the quality of care here has just skyrocketed to where this is the same care I would give you at a private clinic. Okay?
Wow.
And
So you've
that's
really upped the
great.
quality.
Absolutely, absolutely. Because initially, we didn't have the funds to do even basic blood tests, you know.
Wow.
And our patients couldn't afford even, inexpensive medications. And now there are a lot of programs in place where those aren't issues anymore. So
Fabulous. Wow.
it's great.
Congratulations.
And
That's
then
good.
I know it's been wonderful. That's based on a lot of great community partners and the work that Beth does and the work that's gone on before. And then the other phenomenal thing, of course, is so I have patients now that I've seen here for 15 years or more.
Wow. So you've
right?
had an ongoing relationship
Right.
with them, really.
That's
And
right.
developed
That's
a
right.
great
It's just
friendship.
like a regular family practice. Mm-hmm. And they're so grateful.
I bet.
And their chronic disease is managed. They're taking care of themselves.
Wow.
We're keeping them out of the emergency room. Their health is good. Things are just dramatically better in their life because of the health care they get here.
Yeah. Well, I'm so impressed with the longevity you've had and how you've upped the quality and the professionalism. I mean, it's no surprise to me, but way to go. And you're providing such an important service to this community. So thanks for all you do.
Thank you. Likewise to you and the Christian Center, Rob.
Yeah. Well, it's really obvious, as you heard from Dr. Hanrahan, this place has grown and grown. Well, I know this costs money. This doesn't just come out of the air, right? So you have to fund this. Talk a little bit about the funding mechanism. What's your process and where are you in that process? And how can people support this organization?
So a key component of what we do is, or what we don't do, is we take no federal funding.
Okay.
And by taking no federal funding and having really utilizing volunteers, we provide the health care that we do for 8,500 and more patient visits every year for a budget of less than $900,000 a year. So that really, if you equate that down, all coverage and all cost included is about $75 per patient visit, which is probably, actually it's closer to 70 than 75, but which is lower than anyone else.
Anywhere, yeah.
Yeah. So, and how we get that money, we ask every patient to make a donation.
Okay, so it's not completely free.
It is completely free because they can say, you know what, today I can't do that for you.
Okay, all right.
So it doesn't matter. We say, would
We
you
just
like
need-
to? And then if they say I can't, then we still bring them back and see them.
Got it.
Some people, if they can't, they'll give what they can because they
Okay.
like to feel like they are part of their care. They're able to give back, and they really appreciate what we do for them here at the clinic.
I'm sure
We do a lot of grant writing, so
Okay.
we do get grants from the state and local governments from the city.
Okay.
We also get a lot of money from family foundations.
Got it.
A lot of our money just comes from our fundraising efforts and from just private individuals that appreciate what we do and want to give back to the community in this way.
So it sounds like, would you say over half of your support comes from individuals and or family foundations?
Oh,
Is it that high?
absolutely. Yeah.
So if people are watching this and you have a desire, you love this kind of work, you could give, and you could go online, I'm assuming you can give. You could go to one of your
Absolutely.
events.
Yeah,
which
the
is
best way
great.
to give, if if you want to, come in and do a tour of the clinic, and we can walk you through. We can show you what we do.
Great.
Talk to you about our volunteer opportunities.
Yeah.
And then if you feel that it's something that speaks to you, then happy to talk to you about different ways of giving that we have. Anything from stock donations to end-of-life giving to just writing a check for us. So you can, if you don't have time to come in, you can go to peopleshealthclinic.org.
Okay. Perfect.
And you can donate online. You can attend one of our events. You can give during Live PC, Give PC,
Right.
or look at our annual appeal at the end of the year and consider making your year-end giving to People's Health Clinic.
Sounds good. We do such good work. Thanks, Beth, for all you do. And again, if you're watching this and you're like, I want to find out more about this, I want to volunteer, I want to give money, go to peopleshealthclinic.org,
Yes.
and you can find more information about that. And of course, you're on Facebook because I've seen you on there, on Twitter. You can check out, get to know a little bit more about Beth. But thank you again for giving us this tour. It's
Thank
fantastic.
you. Thanks for the opportunity.
Absolutely. I think it's bigger and more than what people realize. So thanks for all you do again to serve this community.
Thank you. And we, as you can see, we provide quality health care for the uninsured.
Well done. Thank you
you.
so much, Beth. Really appreciate
Thank
it.
you.
Well, I really hope you've enjoyed this tour of the People's Health Clinic. It's such a great organization. And as Beth said, come by, take a tour, go to their website. You can check out more information. They do such good work. They really are making a difference in this community. So I encourage you to check out the peopleshealthclinic.org. And Chris Waddell, I mean, what an inspiring guy, huh? I knew you'd love his story, and he truly has become one of my heroes because his story is so powerful. He's overcome so many obstacles. So I encourage you also, you can find out more about him. He's all over actually social media. And then of course his nonprofit is called One Revolution. So you can check that out. He speaks all over the country and the world, inspiring kids to really overcome their obstacles. So I encourage you to check it out. And really that's what our show is all about. We want to feature people that will inspire you. So whether you're in the nonprofit world, you're in the for-profit sector, or you're in the government role perhaps, we believe that you can make a difference in your world, and we encourage you to do that. Well, that's all for now. Don't forget, every Friday, 9:30 a.m. on Park City Television, we encourage you to check out the Impact and Influence Show. That's all for today. Until next time, keep making your world better.